This is John Ekaru. He's just 9 years old, and for the past 3 weeks, he has been fighting for his life at the Lodwar Referral Hospital, some 674 kilometers from the Kenyan capital, Nairobi. His body is weak, his spleen swollen, and he struggles to open his eyes.
We first thought it was malaria and were treated for malaria at a health center, but there were no changes. Days later, his body became hot and could not even sleep at night. He wasn't eating at all and was forced to bring him here.
Doctors say he has Kala-azar, a deadly disease that most people outside this region may never even heard of. Here in parts of northern Kenya, from Turkana to Wajir, 1,123 kilometers apart, the number of Kala-azar cases is quietly rising, devastating families already burdened by drought, poverty, and insecurity. At this facility, many parents, like John's father, Charles Ekiru, have walked for kilometers, others days, carrying their sick children in the scorching heat, hoping to find treatment. The facility's wards are full, with some children being forced to lie on thin mattresses in the hospital corridors, clinging to life. Worried parents sit beside them, praying and hoping that they get better. So far, 34 people have lost their lives since the beginning of January.
The doctor asked me to look for a blood donor. Now that's my current predicament, and he also asked me to go to a chemist and purchase drugs for my boy. I do not have the money.
What kills mostly is one, when you've got anemia, and then when you've got very low platelets, and then when you've got a comorbidity, that's another independent disease together occurring together with serial leishmaniasis.
Health experts say Kala-azar is cruel. It targets the most vulnerable and hides in silence. But what is even crueler is that it's been ignored.
As malaria.
Kala-azar, or visceral leishmaniasis, is a neglected tropical disease that can be fatal if untreated. If left untreated, it's fatal in over 95% of cases. The disease is transmitted by the bite of infected female phlebotomine sandflies found in anthills, which are very common in these regions. The Drugs for Neglected Diseases Initiative, DNDI, says action must be taken now with better healthcare, early testing, and sustained awareness. The International Health NGO has been providing medical assistance to facilities like Lodwar Referral Hospital. The Kenyan government has been responding to an outbreak that has left over 30 people dead in Wajir County, with hospitals overwhelmed with the rising number of infections since December last year.
We have come together with development partners who have been able to assist us with drugs and other commodities. The National Treasury equally has released some funding that is going to assist us to add the commodities that are going to these counties.
For parents whose children are hospitalized with Kala-azar, the hope is they respond to treatment and get better soon. Enoxicoli, CGTN.